Welcome back. So there's a question here. Is it the right thing to do by having multiple sex partner as a female to solve your infertility problem? That's the question. Let's follow this video to get the right thing to do. So when it comes to infertility as a female, here are few body hormones for female to work on, to look at. The first one is called the LH. We have the other one is the progesterone, and finally we have the what? Estrogen. All these body hormones, they can function in you as a female. We'll go to the multiple sex partner question. We'll answer it. Don't worry. But all these things are things I need to know first. They got very important function in you. So if you see this one, this one has a own function. Now, before we get there, is a cycle length of a woman is the number of days between two periods. So during menses, what happens is you have this progesterone and estrogen level going low. So that means when they are low, they allow all the formation of the uterine lining to shed out, called menses in women, for a few days, 3 up to 4, 5, 6, 7 days. So when they are at high level, they keep the uterine lining intact and doesn't shed out. So that's the reason why we need to know their level anytime you are discussing pregnancy, so you can understand something better. Now let's know the function of these two guys too. After menses, when this guy already function, after menses, the next person that comes up is the function of this guy. Follicle stimulating hormone is responsible to stimulate the follicle cycle within the ovary for an egg to mature. The maturation of the egg process is responsible by this guy, and this guy is released from the pituitary gland in the brain. Same thing with this guy too. So if this guy is not adequate, he will not mature an egg. He will not stimulate follicle to mature an egg. So he has to be adequate. So you have to check to know his normal level in your body as a woman during that cycle period. The time at which it is to function is the time that you go to the hospital for the test. It's the time the gynecologist will call you to the hospital for the test. So this guy has to be tested to know, followed by this LH. After the one stimulate egg formation, is this one that will stimulate the release of egg, which is the ovulation process. So when the egg is released, then it gets exposed to sperm cells for fertilization. So most people are missing, they don't even know their safe period from unsafe period, they don't know their ovulation time. They don't even know what cycle length is. So like I said, cycle length is the number of days between two menses. So we have the day you start your first period up to the last day before you start seeing another period. Make sure it should not be less than 21 days and it should not be more than 35 days. Then it's normal. So then you know how to use it and estimate, calculate to know your ovulation time. We'll give you we'll do another video on calculating ovulation, but these are things that we have been doing over and over. So if you are following our page, look for how to know your ovulation cycle, how to calculate safe period. We did a video on this platform. It's there, so check it out. So after you have considered all of the function of these hormones in you as a female, make sure that they are all checked at the right time. So when your menses starts, remember these two things go very low. So when you are pregnant, do the test of these two guys, progesterone and estrogen, where you start seeing small blood things coming. Check them out, maybe they are getting low, because the only way they will release the fertilized egg that has turned to embryo, the only way they can release the attachment of that egg from the uterus, except the two guys are low, progesterone and estrogen. Once they are low, they cannot allow, they are not strong enough to allow the attachment of the embryo to the uterine lining. So check it out and make sure they are normal. That's the thing. So your ability to get pregnant, now look at your ability to get pregnant. This is the guy, the two people that will be responsible to help you in that process. So when you start getting involved with the mentality that maybe I'm okay, but the guy I'm having as a spouse is not okay, so I want to go privately and sleep with another man who will get me pregnant and will put the pregnancy on my husband. DNA will still discover you tomorrow. So don't give yourself a headache. What you do, avoid multiple sex partners, because what you're going to do now is exposing yourself to a lot of infections, and those same infections can stop you from being pregnant. Syphilis can stop you, and you have HPV. HPV can also prevent you from being pregnant. You have other kind of infections that will affect your ability to become pregnant. So sometimes when you do ultrasound, some people have that kind of uterus. Some of them, the uterus not pointing, the cervix is not pointing straight like this. Some people cervix pointing backward. Some people pointing up. Some people pointing on the left. Some people cervix pointing on the right. So that certain sex position can allow you to get pregnant easily. Some people understand this. So when you're talking about sex position, people sound or they consider you to be sounding rude. But it's important because when you know how your cervix is positioned, sometimes it gives little difficulties for sperm cells to travel directly. It travels, but sometimes it gives challenges and makes it difficult. So certain sex position can allow it to happen. So we are advising you having multiple sex partners to say you want to pick a one until you get pregnant by all costs can expose you to more harm, HIV, infections, different kind of infections, and you will not become pregnant. The right procedure is what we just explained. Go and check your body hormones, know your regular menses, and know your ovulation period so you can know when to do what to do. And make sure too your spouse has to do his sperm analysis, or like you say semen analysis, to make sure that he has a good mortality of the sperm cells and to also have a better volume of sperm so that he can be able to get you pregnant. There are things to avoid when you want to get pregnant. Stop taking any medication at any time. Do not take medication during menses. Menses is not infection. It's a natural process. Don't take antibiotics. Every menstrual flow, most women take antibiotics. And your men too should avoid taking medication without prescription. Always when you're planning for pregnancy as a couple, get a health worker involved, and he should be the only person, he or she should be the only person that will be responsible to treat any condition about you people. That's the only way you can get pregnant. Stop finding your own solution. Thank you. Follow for more.